The broadcast is now starting. All attendees are in listen-only mode.
Hi, good afternoon, everybody. Welcome to our CBAS updates, policy and program updates for February, the first of the year and probably the first of many to come this year. I'm Jill Sparrow. I'm the CBAS branch chief, and so glad you could join us today. Our webinar is scheduled for about an hour and a half today, which I think will allow us plenty of time to cover plenty of content, and should be plenty of time for questions as well. Presenting with me today, just want to introduce my co-presenters, Denise Peach, who is a retired CDA CBAS branch chief. And also with me today is Arlitra Hutchinson, who is one of our CBAS certification analysts. So we'll be covering quite a bit of information for us today. Next, and behind the scenes, we have Adam Smith, who is helping us with the technical aspect of today's webinar. So next slide, please. Okay, so just a few housekeeping items before we dive in here. Again, we're happy that all of you could join us today. We have quite a number of people registered. I think almost 500 people registered for today's webinar, so that's great. Glad everyone is able to be here and listen in. We, as always, we welcome your questions. We hope that this webinar will be an opportunity to get your questions answered. And if you do have some questions, please submit them via the webinar in the questions box. So we will be monitoring those. Most likely, I will probably try and defer most of the questions to the end of the presentation. I have a sense that it may be likely that we may answer some of your questions as we go through today's webinar. So we'll be taking most questions at the end. The webinar is being recorded, and we will be posting it on our CDA website at the link that you see below. Our goal is to have it posted by the end of next week, so just give us a few days to get that posted. And as always, if you have some of your fellow staff or other providers who weren't able to join us today, if you know, please encourage them to listen in to the webinar once we've posted it on our website. I should also mention too that the slides for today's webinar are in the handouts box of the webinar, so you can download those there. All right, next slide, please. Okay, so just a quick overview of our agenda today. I'll just actually start with just kind of an overview, kind of where we want to go, what we want to accomplish today. And really, the two basic goals, I think, for today's webinar is one, to make you aware of the latest administrative and business updates from the branch. And also in the second half of the portion of our webinar today, we'll be really looking at and wanting to get all of you thinking about and planning for the transition back to the safe delivery of services in your centers. So we'll spend a great deal of time on that today. And over the course of today's webinar too, we'll be acknowledging all the successes and the hard work over the past year, and sharing with you kind of our observations and what we see as challenges and opportunities that we will be facing in the months to come. Next slide, please. Okay, so we're going to just jump into CDA business updates, and this is where for our first slide today, I'm going to hand it over to Arlitra, who's going to just provide some information and some tips from the certification desk. So Arlitra, I'll hand it over to you, and I will mute myself. Okay, next slide. Okay. See if we can unmute Arlitra. All right, Arlitra, are you able to unmute yourself? All right. Well, and I can't read lips, so if Arlitra was speaking, I'd be able just to repeat what she is saying, but. All right. I just give it another second and see if we had her off mute earlier, so. Okay.
Hello.
Okay.
Can you hear me?
We can hear you. Yeah.
Okay.
Oh, I don't think we can see your the slides now. So. Okay.
Do I need to show the slides on my end? Because it's saying show my screen.
Why don't we try that? Do you have them, Arlitra?
I do.
Okay. Why don't you go ahead and show your slides, and then we'll give it back to Adam once you're done.
Okay. Can you see?
Yeah, we probably just need to make your slides a full screen because we can see your desktop, your background. There we go. Perfect.
Why isn't this? Okay. Sorry about that. All right. So as Jill said, my name's Arlitra. I work at the certification desk. So I process the renewals as well as the change applications for centers. And I have a partner that works with me. His name's Eric Fredericks. And we just wanted to give you some information regarding tips for submitting your change applications to CDA. Currently, license capacity increase and decrease, location changes, ownership changes, shareholder changes, administrator and program director changes should be submitted to CDA first. And then we review the application and make sure that it's complete for CDA purposes. And then we forward your application to CDPH with a recommendation, whether we're approving it or recommending another action. If you go to CDPH's website, they also have that noted in their examples that you need a pre-screen approval letter from CDA if you're a CBAS provider. So that's what they mean by that. And in order to not have your application, the clock start at CDPH, you want to send it to us first because they will deem your application incomplete if they have not received that approval letter from CDA first. So the link, is it on here?
It may be down below.
Yeah, so under resources is the link for where our application materials as well as the instructions are located. And you would want to go there to get everything that you need to submit to us, and then we will forward it. For other types of applications that don't go through CDA, like a change in your hours or your days of operation, that will go directly to CDPH. We've also included the link to get that information. Their page has tutorials as well as it's a drop-down selection where you can pick the type of provider you are and what type of application you'd want to submit, and it will give you an example, a list of all the forms you need, and instructions. So that's very helpful. And then for the change applications, you want to make sure that you go through the instructions, not only that we have posted for the type of application, but as well as the instructions on the form. They should be used in conjunction in order to have a complete application. Me or Eric would reach out to you with corrections, and then you want to make sure that you submit them timely so that we can get it over to CDPH for processing. And that's pretty much everything I wanted to go over. If you have questions, you can always send us an email to the CBAS email and it'll get forwarded to us, or if you have our emails, you can email us directly as well. Okay. Let's see.
Arlitra, I have one question we might as well address right now. Do you have a sense right now, just the length of time for processing or getting the capacity increase applications processed? I know it just really depends on what's.
Yeah, it really varies depending on our current workloads. I want to say right now, I think I have three change applications, but if we have a lot, it takes longer. If we have a little bit, shorter, but it should get reviewed, at least looked at within 30 days, about probably, I would say.
Okay, thanks.
Mhm.
Okay. All right. And I don't see any other questions at the moment. Adam, are you able to show your screen again or take back presenter controls?
I click stop showing screen.
No, Arlitra's marked as the presenter, so I can't do anything.
Okay.
Okay, so change presenter, go back to, there's 2 organizers, and then I have Denise.
Okay. All right. Okay, Adam, how about you now? All right, Adam, back to you as presenter. Great. Okay. So we'll move on to the next slide then. Okay. Just some more updates then that we wanted to share with you today. The first one was in regards to Alt Center Letter ACL 2017, which was revised. We initially issued this ACL late in 2020, and then just recently, in January 22nd, we issued a revision to that ACL. If you recall, the original ACL and the revision, it has to do with incident reporting. We revised the incident reporting form, so there is a new form on our website. So please check that out. But actually, the revisions contained in the new ACL that was just distributed in January, they had to do with an update to the reporting requirements around COVID. So I urge you, if you haven't read that ACL, please take a look at that. The reporting criteria was revised, and it was limited and more focused approach to reporting. So right now, the reporting criteria for COVID is providers are required to report when ADHD or CVAS participants have tested positive for COVID and they have a positive test result. So I would just encourage you to look at that ACL for more information about how to report the form itself. And if you have any questions after reviewing it, again, please get in contact with your analyst or nurse on the team. I'll be happy to walk you through that. And again, the ACL does state that these requirements are in effect, were in effect immediately upon issuance of the ACL. Okay. So the next update just has to do with our 1115 demonstration, our Medi-Cal 2020 waiver. As many of you may know, our waiver, the demonstration of the Medi-Cal 2020 waiver expired this past December of 2020. DHCS applied and requested an extension from CMS for that waiver, and we were granted an extension through December 31st of this year, 2021. So right now, DHCS, in collaboration with CDA, is in the process of revising, updating this program, special terms and conditions, and the standards of participation for that waiver. So right now, the changes are really primarily technical in nature, and really no significant changes to the CVAS program rules. But as always, there will be a public comment period for people to review those changes and provide feedback. So more to come on that. Keep a lookout. Okay, next slide. Okay. So this next item is I want to make you available. Recently, CDA was notified that additional personal protective equipment, PPE, is available to CVAS providers through the Office of Emergency Services. If you recall, several months ago, we're able through Office of Emergency Services to have CVAS providers get access to some PPE. So now there is more PPE available, and it will be available ongoing until further notice. So we are going to be setting up a a process for CVS providers to be able to order PPE as needed. We're asking providers to submit orders for that PPE by the 10th of each month. Again, order as needed. And those orders will be submitted to Rebecca Hinkson at CDA. Rebecca's name may be new to most of you. She actually works directly under our deputy director as an assistant to our deputy director. So she will be kind of managing the logistics, collecting orders and getting them to Office of Emergency Services, et cetera. So you for the program. So we will be keep an eye out. We will be emailing everyone some more information about this new process. You should be getting an email with a blank order form template and instructions for how to fill out the order form and how to submit the order. And that should be coming by the end of this month. I would expect next week that you all should be receiving that. And again, if anyone has questions, we're happy to take those related to that. Okay. Then the next item on our agenda here is just looking at, wanted to just remind you about the CDA, the CDAS website. And you can find it at the link there. Adam, are you able to just bring up our landing page? Thank you. Okay. So just wanted to offer a reminder to everybody of the website and what can be found there. There's a lot of information here. It's kind of your go-to place if you're in needs of forms and instructions. In addition to that form and instructions tab that you see, we also have video tutorials on how to complete different forms, such as the MSSR or the PCR. And I say that even especially for new providers who may just be kind of starting off and maybe not as familiar with the processes as they've been established, I encourage you to take a look at those. Also, part of our website, we have that tab you'll see down there where it says Toolkit. And under that, we have various items, information that may be helpful. For example, we have our center assessment tools, which provide some information about program requirements on in different areas, such as medication administration, requirements for I'd say social workers, and various different other program requirements. And there's various tools that kind of lay out those, and I think help kind of like a checklist for providers to go through and kind of assess how they're doing in each of these areas. Are they meeting the various program requirements? And we often encourage providers to take a look at those, especially prior to on an ongoing basis, but especially prior to our surveys when we conduct those surveys. Also, just wanted to give you a heads up, we will be adding some additional information to the web page in the near future under data room reports. It's been a while since we've updated data related to the information that we obtained from the participant characteristics report. That report that you all complete and send in twice a year. So we will be updating the website with data from that from June's report in the very near future, and then hopefully we'll be maintaining that regularly. So and we figured that will be statewide data, and also data we'll have data broken down by center, by county, for people to view and to get a sense of just again the characteristics and of the participants, the people that we serve. So that's again just again, all center letters are located here if you ever want to find one, various forms, things like that, and listing of CVS providers around the state, in your area, wherever it may be. That is all right here. Okay, Adam, thanks. We can get back to the slides. Okay, let's move on to the next slide. All right, so just the last update, want to make you aware, if you haven't been already, CDPH issued some recent guidance, recent update on vaccine information. On the February 12th they issued guidance that spoke to persons with disabilities with high-risk conditions ages 16 to 65, and that these individuals will have access to the COVID-19 vaccine beginning in March on March 15th. So this is great news, and obviously pertains directly to the people that we serve, and probably actually expands the scope of people eligible for the vaccine, and definitely it's pretty much probably covers 99% of CBAS participants. So that was good news. If you haven't seen this particular publication, CDPH did put it out in the form of a provider bulletin, and you can see the link below there is on our slide there. So you can view that in full right there. Okay, next slide. All right, so that sort of ends our brief business updates from the branch, and I am going to be handing it over to Denise to take us through kind of just a discussion and some about where we're headed with planning for this next upcoming several months, return to center-based services, and just talk about some considerations and what's been happening along those lines. Okay, Denise, it's all yours.
Thanks, Jill, and hello, everyone. I'm really happy to be here today, and I'm glad that Jill's keeping me around for all of the excitement of this last year and the things ahead. Lots of things for us to work through together. So I'm happy to continue to be part of the team. Next slide, please. So in the discussion about 2020 and 2021 and beyond, just wanted to take a moment to have a few reflections and then talk about the road ahead. So over the past 12 months, when we were thinking about our presentation today, it occurs to us that last year at this time we were all just sort of waking up to this new virus threat, and didn't even have the name, I don't believe, the COVID-19. We were calling it a coronavirus, a SARS-2, a coronavirus. But at any rate, we have all been on an accelerated path for the last 12 months, learning together, coming together under the common goal of redesigning our service delivery for the ADHD CBAS program to make sure that those at greatest risk remained safe at home. And that was all just leading up to the beginning of our March last year, almost to where we are right now. And we want to take a minute to give a big thank you to all of our providers out there, everyone actually who's been involved in your ADHD CBAS community to make this pivot and to bring the services and supports to the 35,000 plus participants while they've remained at home. So just, that's the summary there. We've innovated, we've done our parts, and we've had a lot of great successes. So we want to start with that. On the where we're headed theme, where we're headed is, first of all, I guess, we have to acknowledge the obvious, which is that we are still in the COVID public health emergency, and we don't know how long this will last. We have a lot of reasons to feel optimistic right at the moment with infection rates going down, hospitalizations going down, deaths going down. This is all good news, but there are still many, many unknowns that are out there with regards to variants and just again how long we will need to stay in this sort of emergency mode. So now, as Jill alluded, we share this common goal of getting back to the center-based services as soon as safely possible, and not sooner. But yet we still don't have a lot of the answers we need to get there. But today is about talking to you about the planning that's underway and to assure you that we will get there. And so the timeline is unknown, but we're telling you a little bit about what we're thinking about and what we're doing to get moving in that direction. And we want to enlist the provider community, as I'm sure you already are, thinking about how to get back to the thing that you do best with hands-on, eyes-on, hearts all in, as always, with providing care in your centers. So you've done a great job over the last 12 months, and we're going to continue in sort of this flexible public health emergency mode for a bit, but we are moving in the direction of back to in-center services. So next slide, please, Adam. So from crisis to vision, that's what we're saying for in 2021. So just about in 2020, every Monday afternoon, and for that matter, most of our Wednesday mornings for webinars and lots of calls and emails in between, CDA has been engaged in working with the CADS and ALE leadership, known as the crisis team, over the past 12 months. We're now sort of trying to rebrand ourselves into the vision team, or we are rebranding ourselves as that. And you know, basically over the last year, we've spent our time trying to figure out how to do all the things that were necessary to pivot and bring services to participants remotely, to bring them to the home, and to provide an awful lot of training and information about that. And now we're working, continuing to work just with our eyes on the road ahead, in adapting the model, innovating, and continuing to respond to this public health emergency, to, again, continue to keep people safe and meet them where they are. And we hope that's back in the centers very soon. So we've been developing all these guidelines, informational materials, training, all with these common goals of taking care of our high-risk participants, and many of whom are those who have disparate health outcomes and have the highest risk for COVID and institutional placement. So as we look ahead to 2021, we're going to undoubtedly be just as busy as we were in 2020. In figuring out all of the innovations and the things necessary, the steps necessary to make the transitions back into our centers. Next slide, please. So we moved from this crisis mode to the vision mode, so on this team that we have been participating on every Monday afternoon, we have been, again, staying on our Monday schedule, and we started the beginning of the new year first by asking ourselves several questions. You know, what are we trying to achieve here? What are our priorities? How do we focus our efforts on what's most needed and important now and going forward? And we started by asking ourselves some key questions about where we have been, what we've learned. So to recap, our visioning efforts started in January, and we started with talking about, well, what's gone really well over this last year. And these are some of the things that some of the leadership in CADS and Alliance for Leadership and some of your provider colleagues have shared, things that they think that they learned and that they can do and even do better, so that they more fully understand the participants' home environments and the needs of caregivers. That was a big one, big emphasis on caregivers and fully understanding people in their homes and their home environments. Keeping participants connected and receiving services when they're sick or when they're too weak to attend the center, if they would not be able to attend the center prior to March of 2020, they wouldn't get services, and through temporary alternative services and the things we've learned to do in this last year, we can bring services when people are unable to attend the center. Many participants are again getting the services where they are, and that is with telehealth at home. There has been some limited individual in-center services, but mostly it's been in the home. Providers say that they've been able to network and coordinate care and provide referrals better, which results in comprehensive service delivery. Again, all good news. Better follow-up on post-hospitalization efforts, that's been a big improvement, and that you're able to further your mission of providing person-centered care including meeting needs of both, again, participants and caregivers through these deeper connections that you've built with the participants in their homes. One of our vision team leaders, who's also a program director for CBAS Center, captured the sentiments, we think, with he says, we know more, we do more, and we care more. So, so again, a nod and a tip of the hat to all of you guys who have learned all these things over this last year, and recognizing that we want to take many of these lessons forward as we create our roadmap to the next sort of CBAS 2.0, I guess, in the years to come, how we can build on these things we've learned in this time. Next slide, Adam. So, we have again, we've been asking ourselves, what is it that we need to focus on, and clearly our charter is to figure out what is going to be the roadmap for ADHD CBAS program 2021 and beyond. The obvious thing that we needed to focus on first, our most immediate thing, which is right in front of us, which is our number one effort in developing this roadmap, is to safely and incrementally transition the program back to center-based services while maintaining necessary flexibility as the public health emergency continues. And then our second efforts will focus on initiatives farther reaching and intersecting efforts with other initiatives in the state going forward, to build upon past experience and lessons learned during the public health emergency, to adapt the program going forward in support of the visions and principles adopted in California's Master Plan on Aging. And again, I would add not just the Master Plan on Aging, but also many other initiatives that are going forward, the whole alphabet soup of efforts under the care and supports umbrella for people we've long served in ADHD and CBAS, efforts like CalAIM, efforts like MLTSS, Managed Long-Term Services and Supports, Home and Community-Based Services, et cetera. So that's going to be our second focus, again, once we do all the hard work that we're going to be talking about here a little bit today under our first focus area of transitioning back to in-center services. Moving along to the next slide, please. So our most immediate focus, the roadmap, is the transition back to in-center services. So again, we're continuing to meet, collaborating with our state and managed care plan partners to address all these key questions and ensure sort of an agreement on an approach, considering the variables impacting the transition. We're going to talk a lot about those today. Developing policy and guidance for providers to make the center-based services work again. And meanwhile, preparing internally in our branch to make sure that staff and processes are in place to guide the transition. And then obviously a most urgent matter right now is focusing on vaccines and working to assist providers to help their participants get vaccinated. This, I would say, is a priority one, and our weekly at ALE Web Talks have focused a great deal on vaccines, and so so this has been a really great effort that they've made, and we're appreciative of all of the expertise they've brought to the table to talk to you about vaccines. Next slide. More to come on that as well. So the roadmap. Again, where I would like to emphasize here is that as we think about the way forward and our most immediate goal of getting into our centers again for service delivery when it's safe, we recognize that there are you know, many public health factors that dictate the earliest possible date for that safe return. But there are also other factors, and that have to do with our readiness and your readiness. So the two primary categories that we're focusing on are the environmental factors and getting answers to questions in these areas around the federal, state, local public health guidance that comes around what's happening in each of our regions and counties, regarding infection spread and hospitalization rates, et cetera, community vaccination levels. And when we think about community, I think we're trying to think of community in terms of not just your broader community, but your ADHD CVAS community, your staff, your participants, their families, what's happening with those vaccination levels, the PPE availability, and your needs in those areas, what kinds of testing is available, transportation. There are many, many categories of things here that we need to consider about the environment at large, and what will dictate when we're capable to get back in our centers for regular services. And then under the category of provider readiness, again, and I would say it's not just provider readiness, it's to some degree the state readiness to assist you in what will be our processes to clarify questions you'll have regarding what the rules will be, and assist you back what the process will be for getting approvals to get back in center. There will be many steps to ensure that we're all ready, and so this is part of what we're thinking through in our vision team efforts. What kinds of staffing levels will you need? What kinds of things will have to happen in your facilities to make things safe? What kinds of policies, protocols, et cetera, will you need to have in place, and staff training, et cetera? So many, many things in those categories, but these are the two main categories of things that we're looking at to be the factors that will impact and come into play in getting back into center-based services. Next slide.
Yeah, and Denise, I was just saying, this is probably stating the obvious here for everybody, but I think we've commented too that just the planning for getting back to center-based services certainly seems more fraught with more unknowns, and certainly seems to be will be kind of a lengthier process than it was getting getting pass. So it's been a challenge, and I think even us, we've talked even here at the state, there's just so many things that we need to think about and consider, and certainly the pace, while we are been working on this, it feels like day and night. It's certainly it will be kind of a longer process than initially was this time last year, so to speak. So
yeah. And I would say on that, thankfully, because we made such rapid changes last time, and we, I think, did a pretty amazing job given the circumstances. But it's a gift to have a little bit more time to do this planning now. So yeah, so we're happy to be getting started with all of this today, and bringing more of you into the conversation. And Jill, you teed up beautifully the next slide, which is that that we know you have a ton of questions, and as Jill alluded, so do we. So we're just going to throw them all out here. I didn't want to sound discouraging about you all throwing questions into the chat box and asking us, or the questions box and asking us things. But you're likely going to hear things today like, we're not there yet, we're working on that, we've got questions in to public health or healthcare services or wherever else to see if we can work with our colleagues to get these things answered. But that is likely what we're going to have to say to a lot of things today. But again, I think that getting the wheels turning and getting everybody thinking about these things is where we are at this point in time. So this is just sort of a throw a bunch of questions at the wall. When is all this going to happen? Will vaccinations be mandatory? How will things work once people get vaccinated? How long will the temporary the task all center letters and policy be in effect? What will the staffing requirements be? How many participants can we have at the center? How many hours will they be there? Do we need to reassess everybody before bringing them back? And what about flow sheets? Everybody always wants to know about flow sheets and progress notes and quarterly notes and all that other documentation. So we know you have a million questions. And again, we don't want to discourage you from asking them. We can certainly, Jill and I, at the end of this hour, we can bat them around and see what we could answer. But much of it is just sort of stargazing at this point and trying to figure out our way through these matters. But we will, rest assured, get these things figured out. Next slide, and just so you know, some more unknowns that are really, these are issues that, our partners at Department of Public Health are wrestling with. Frankly, public health departments across the country are grappling with these same kinds of questions. We've all got our work cut out for us figuring many of these things out. But we have these questions in play as well, and we meet regularly with our colleagues to talk through some of these things. So, here's just a few of them. Will centers be allowed to serve individuals or youth staff who aren't vaccinated? Since CBAS participants are required to be free of communicable disease on enrollment, will participants need to be tested, as with TB clearances, to return to the center? If so, at what frequency? Can the center refuse to serve someone who isn't vaccinated, or make it a term of participation? If vaccinations are going to be required, will there be vaccination exemptions allowed, as in schools, like with the MMR vaccinations? What requirements will the center be requiring continuing masking and social distancing? Will those still apply if all participants and staff are vaccinated? So you can see there's a ton of questions that we have as well, and so again, the point we want to make here is that we are working along with so many of our partners to get some of these things answered. So next slide. So as we think about returning to center-based services, here are some things, I would say high-level points that we want you to walk away with today, things you need to know and things you need to do. So things that you need to know right off the top is that the public health emergency will eventually end. Of course, we don't know when, but what we do know is that things will not continue as they are now. You will be transitioning back. As yet, we don't have the dates. There won't be an on-off switch. I think I was on a webinar yesterday with our social services colleagues talking to our community care licensed providers and community, and they were using the same terminology, which is that we're not going to flip a switch and have you one day serving all your participants at home and the next day everyone's back in the center. What we envision is a transition back, something that makes sense, similar to the schools reopening. We're thinking of this in phases. So blood pressure check for everybody. It's not going to happen all at once. So deep breath. We're going to work on making this happen in sensible phases. The transition will likely include a time where you're serving both participants in center and remotely, meaning you'll probably do both, concurrent or blended program. We're not sure at this point, but we feel pretty certain that you're not going to bring everybody back in any orderly manner at the same time, and we want it to be an orderly transition. CDA and all of our state and managed care plan and vision team partners are working on those details now. Again, we have a lot of questions, and that there are many variables that with COVID that are beyond our control, and they will affect our timelines. So we're trying to think in timelines now. But again, more things will unfold that will affect and shape those timelines, and we're well aware of that. But meanwhile, we lay our plans.
Yeah, and I think just that too, back to the planning and transitioning, and we know, it's quite clear in talking about different variables that are going to affect things. We know that many providers may move through kind of the transition phase of getting back to, their ability to provide in center-based services. Perhaps sooner than others, based on kind of individual circumstances with each center. So we're kind of sensitive to that in terms of, where each provider may be in terms of readiness and planning. So.
Right, and we've heard that even among our our leadership team talking about all of this roadmap, and that we see that we have centers that have had, when we talk about that community vaccination issue, we have communities of staff, participants who are all vaccinated. So they're asking this very thing. When is it we can get back, and what will be the requirements? Again, some of those questions that we don't have answered for them as yet. They may have everybody ready in the next couple months from a vaccination point of view. But if the data that are coming out around vaccines, or if the variants play, throw us a change-up pitch here, and this has some impact on our ability to gather back in center and do so safely, then that whole accelerated timeline for some of those folks may need to shift. So we're still working out all these details, and so we don't want anybody getting ahead of us, but trying to get you to think about these things, now. All right, next slide. So more about returning to center services that we think are some of the takeaways that we want you to come away with today. So what do you need to do now? What you need to know now is what we just talked about. What you need to do now, beginning your planning today, assisting your staff and participants with vaccinations. As I've mentioned, our ALE web talks on Wednesdays, there's been a great deal of focus on how to message, how to provide information, how to be trusted messengers with conveying information to the people who have grown to trust you in their communities. Lots of information about that, and then lots of innovative ideas from your fellow providers who have been figuring out how to make calls and make appointments and transport people and really assist them with getting vaccines. So lots more to come on that subject. I know we've got some great experts coming up on webinars in March on the vaccination topic, but that's a critical thing to be working on now. Anticipate how you're going to operationalize the transition. This is, includes things like which of your staff are going to return and which won't. Which staff do you need to hire and train? Which of your participants will want and be able to return? Again, person-centered planning emphasis. Some people may not make it back to the center, and anticipating where these participants fall on this continuum of when and if they might be returning to the center, and at what frequency, and in which order of priority, considering which participants will be physically able to attend for that 4-hour day, and what the center may need to do to prepare them for that eventually. Transportation, obviously a huge issue. Center space and its adequacy if distancing requirements continue to remain in place. So some things that we recommend that you do now: review the current in-center checklist, which is something we developed for our TASK in-center services, the individual services that providers have been continuing to make available. And some of the things that we have asked them to do in ensuring that they do that safely for these last several months. But that list is still something that can help you to prepare. We will likely be updating that as we go forward into this transition to center-based services. But it's still helpful. There's great information in there now. And then review the CALSHA Rule 3205, which is COVID-19 prevention planning for the workplace. All kinds of responsibilities providers have about identifying and correcting hazards, ensuring your employees are screened and trained, and that you have cleaning and disinfection going on, using PPE appropriately, and a whole lot more. So become familiar with your workplace requirements there. So, and, you know, again, we can't say it enough, start planning now, because even though we don't know our exact timeline for return, we know that's where we're headed. And so with this opportunity, as Jill said, unlike when we went into TAS and went into flexible mode in the public health emergency, coming out of this, we have the opportunity to plan and do this in a smooth and orderly way. So that's what we're getting started on now. So join us in that. Next slide. As we have met on our Monday meetings with our colleagues on the Vision team, we capture lots of their thoughts. They're the brain trust, and I've shared with them that I can barely have an original thought anymore because I'm constantly hearing their voices in my head and writing down their thoughts, and these are many of them. So some specifics that your provider colleagues encourage you to be thinking about and doing now. And that is the top of the list is helping to get your staff and participants vaccinated. That would be your first and second doses. Considering how return to center operations is going to work at your center. Many of you developed checklists as you moved into TAS, and probably checklist development is something that will come out of this team, and probably something that you will all be developing as you move back in. Remembering that there's no getting to zero risk. So you're thinking about risk management and harm reduction. So yeah, there's no 100% risk-free environment here, but we are going to do everything we can to manage the risks of being back in center. Don't focus just on getting participants back into the center. Focus on person-centered care, as always, and individual outcomes, overall well-being. Job one is keeping your participants safe, healthy, and connected. And then here's a piece of sage advice we think at CDA. You may want to consider not enrolling more participants or requesting increased days of service at this time if your census is high. We're going to talk a little bit more about this in a bit. But referring to another center or to other service providers that can address participant needs may be the best option as we're looking at all of the pieces that you need to put together, all of the logistics to get back in center. Maybe not the best time to be increasing your responsibilities. Next page, please. Next slide. So in thinking about staffing needs, which is a very important area that the Vision team says you should be thinking about, what staff are, what are your staff doing now, and what will they be doing when they get back in the center? So they've moved into these new roles, and how are they going to be moving back, and who's going to be doing what? What new positions might be needed to replace staff who've left, to accommodate increased participant numbers or needs, or to perform all those new functions that you'll have in the center, like cleaning and sanitation, and perhaps even sort of directing traffic and keeping people safely distanced if that continues to be a need. What additional training needs will you have? Likely a lot. Who's going to be on your assessment team for assessing participants, their changes in function and their willingness and ability to return to the center? Assessing participants for a return is going to be a big part of what needs to happen. Other tips: consider your PPE inventory now and anticipate how quickly you're going to go through it and need to restock once you're back in center. Transportation, again, identifying your needs, considering changes you'll need to make to your facility, and including how you can maximize the use of your outdoor space. And think in terms of your people prep and your facility prep. Those are, again, two sort of big categories of things, maybe for checklists. And with people, I guess you could break it down even into your staffing prep and your participant and family prep. So those are some tips from some pretty smart folks that we talk to all the time. And I'm sure there are a lot more. And if you have any more tips, things that you're doing at your centers, feel free to drop them into the chat box or question box for us. And we collect these things and try to pass them on as wise pieces of advice. So let's see, next slide, please. So challenges and opportunities ahead, endless in both categories. So we recognize at CDA that there are the providers and participants will face lots of challenges returning to center-based services. We've talked about a few of them already. But we also just want to say that we observe that we think that there are going to be some centers that are more prepared than others to return to center-based services. Some of that of their own doing and some of it good luck. But maintaining a steady census with few changes in your utilization rates and few newly enrolled participants since TASC began might be a factor in helping to make the transition back a little easier. If you've experienced, the providers have experienced few changes in staffing and they don't have too great a need to hire for multiple positions, that's also something that might make your jobs easier getting back in. And some of the providers have previously received CDA approval for in-center services, which means that they've completed a updated plan of operation and they've completed the activities on the list I mentioned before, and that I think we're going to take a peek at here now. I think that would be helpful. The in-center services checklist, again, the CDA 7015. Adam, if you could pop that up. We anticipate that we're going to make some changes to this, but just so you know, we'll walk through some of the things that are in here. That is great information, references. We need to bring it up to date. This was like light years away. I think we did this, in June of 2020. Lots has changed since then, but a lot is still relevant in the way of these different sections, the top being various guidelines from the public health community that you need to be familiar with, and physical plant and safety planning, things that you need to think about and do. Infection control, if you keep scrolling down there. Adam, I don't know if you can scroll. If not, it's not that big a deal. But there's an infection control section here. There's a section that deals with participant assessment and service planning, and then various operational changes regarding staffing, et cetera. So lots to think about here in this form. Don't fill it out right now, but know that we're going to be working on getting that a little bit more updated for you with some guidelines of things that you'll need to do in this planning process, and what will ultimately be an approval process for return. That footnote here down at the bottom, that next note, some providers have had significant increases in daily utilization rates. Not that many, but there's a few of you out there who've had really significant increases in utilization. And a lot of new enrollments, some of our new providers who have had individuals who've never been served in the center, for example, that these are going to present some other challenges for you getting back into the center. Lots more to do, including scheduling and assessing. And then some of you who've had high staff turnover and vacancies, you'll be needing to hire multiple new staff members to meet your center daily attendance ratios and address changes in participant needs and numbers. So again, just things to be thinking about. Want to make sure that that we don't state this in too ominous a term, but it is something that, again, as you go forward in your planning, to think about if you've had those big increases, or if you've been relatively stable and you're one of those providers who has had that good fortune of keeping your staff. There's the ability to focus on perhaps getting moving back in center sooner, or just focusing on a whole lot of other things in the meanwhile. So, so wanted to make you aware of those sorts of challenges there. Next slide. So the bold message at the top there, which again, we can't say it often enough, that safety remains the highest priority as plans are activated to return to center-based care. And we still have all these unanswered questions, many of which can only be answered over time. So that's what we're working on now. What we know is that policies put in place for TASC, for our temporary alternative services will ultimately change. And CDA will develop policy and issue new all center letters to implement the changes that are now before us. So providers know that we've made what changes we've made in TAS, and many of those will be sort of unwinding as the public health emergency winds down. So as you prepare, just know that that these are things that we're thinking about. The things that we put in place for TAS are the things that we will have to work on sort of winding down. So things that have to do with daily service requirements, staffing levels, documentation. So again, plan ahead. Now you can't start planning soon enough. And on, just, as a footnote, because again, we, I think, Jill, we meet with Department of Public Health tomorrow, our colleagues, with many questions that we've already put on the table to them. And we note that, that in late January, they put out an all facility letter to their nursing facilities and hospitals that have the temporary waivers for staffing requirements, noting that they must, quote, maintain efforts to increase staffing levels and return to required staffing levels, so that they were going to be, sort of, again, with other provider categories, working toward getting them back into their usual regulatory framework for staffing. So we'll be talking about all these things with Department of Public Health and letting them know. Some of them may be on our call today, but letting them know that we're, working on this orderly transition back, and that we need to work sort of in lockstep with them. But that's, some of the thinking that is in place. So, but I do want to, sort of say to, especially to our providers, that be assured we're not going to push the timeline for having participants in the center and removing flexibilities in a way that would not be safe to do so. So, excuse me. Next slide. One final note, and before I guess we go to some questions here, the governor's master plan on aging. You've probably been hearing a lot about this over the last year. Has put in place 5 very critical goals, and that's for I think it's a 10-year horizon, but numerous initiatives that they're wanting to get started on, an action plan, if you will, for addressing these goals in 2021 and 22. And CBAS is specifically mentioned under goal number 2, which is Health Reimagined. There's the goal: we will have access to care and services we need to optimize our health and quality of life, and to continue to live where we choose. So under this goal, with the person-centered care, closing the equity gap, and improving outcomes as focus areas, Initiative 42, and we've got a link to you there, specifies that we will assess the need and opportunities to modernize regulatory and licensing barriers for CBAS and MSSP. That would be the Multi-Purpose Senior Services Program. So regulatory and licensing barriers that exist, and opportunities to modernize our licensing and regulatory structure. So we think that's pretty exciting, and we're excited about the vision and possibilities included in the master plan. Some of the best minds in the state and, in fact, in the nation took part in developing the plan. It's been an enormous effort on the part of CDA team, our director. We look forward to working on our second focus area in our roadmap efforts with the vision team. That's right there, where we can consider this initial Initiative 42. And our second focus area, just to remind you, I mentioned it earlier, is to build upon our past experience. That's like, what, 45 years of experience in this program now, and lessons learned during this most recent year in the public health emergency, to adapt our services going forward in support of the vision and principles adopted in the master plan on aging. So, so when we we get a little bit past some of our the initial things that are under our noses with regards to this transition back. We will be looking ahead to sort of this broader focus of the future and how we can improve access, improve quality, all that stuff in the program, including looking at these barriers that exist in our regulatory and licensing structure. Not exciting things to many of you, but some of us love laws and regs. So
yeah. And Denise, and I think to that, this may be a good time just to, because this question has come up a couple times, and I think we've touched on it a little bit, but maybe worth reiterating. A couple questions about, will there be room for both, in-person center-based and telehealth services through CVAS, in the future? And I think this is kind of gets at the future planning for CVAS and what the vision team will be looking at too, kind of those two different tracks that we're working on.
Sure. Yeah, and I think that as we talk about this sort of phased and orderly transition back in center, we certainly have the immediate sort of issues to wrestle with around how do we manage sort of continuing some amount of telehealth and remote services while we're bringing people back in center, et cetera. There's that issue. And then there's, well, what about the future? And, certainly things have come up through the managed, the long-term services and supports subcommittee, I think, of the Master Plan on Aging, where they've talked about this issue of having the ability to sort of more flexibly when there are public health emergencies and disasters like fires and things that are environmental disasters in the state, that we could flip into a mode that was flexible, and the need to do that to continue to meet people's needs at home or as they're in their own transitions during disasters. So that's an issue that has come up, and it's something for us to consider. I think to be clear, though, I think our group is going to be putting forward recommendations. This is we're not a policy-making body in that sense. I think we're looking at what are some of the things that we can consider to be opportunities and put them forward to the leadership and the powers that be. So, but that's something that clearly is on our minds. We've learned how important it is to be able to, when there is an emergency, when there is a disaster, to be able to meet people where they are. So, so we'll be looking at some recommendations for how that might be possible. So I think, Jill, if we have one more slide, I don't know if you wanted me to take this or not, or whether we wanted to stop and do some question and answers. I mean, this is kind of the final sort of notes here for things that we do have plenty of time for questions. So I think that, one thing I wanted to make sure that I did before I concluded was to give a huge shout out and thank you to our CADS and ALE teams for their leadership and their continued work last year and this year going forward in developing our roadmap. We can't say it enough, but we couldn't do it without you. So thank you to everybody. And we continue to urge everybody to continue participating in these webinars and trainings, because really, even though we've been talking about sort of this going back to the center for that great care, as Lydia Miss Lees calls it, the secret sauce that you have. I like that expression, and that is the secret sauce is your congregate in-center services. And great work you've been doing remotely, but no substitute for that in-center effort. So, but there's really no going back, really only going forward, and that's what we're trying to think about in all of our planning. And so we're eager to continue that planning and the going forward with you. So those were my summarizing remarks, Jill, and I don't know where we take it from here as far as taking questions.
Yeah, no, thanks, Denise. I think we have some few questions we can take, and it said as you said, there's really no going back, just forward, and I think the upcoming several months will be lots of work in front of us, but also exciting to kind of move us back again to, as we're all very eager, to get back to our center-based services. So let's move to the next slide. Just real quickly, and we'll I think that is next slide, Adam. Yeah, and this is just draw your attention. There's just a resource information here for all of you. Again, some great links to different sites that have various information related to COVID and planning and vaccination, et cetera. So just wanted to point your attention to that. So let me see, we do have some, I think, great, some questions that came in and that we can take a few now. We definitely have a little bit of time. Let me see. Okay, I think we'll start. We have a variety of different questions, some that pertain to kind of the business end of things that we started off the presentation with. We'll kind of move backwards through them. Someone wanted to know, can you talk a little bit more about the vision team and how other providers may have a voice in that group, and if if other providers would like to contribute, how might they do so?
So one thing I would mention is that this group is kind of fully formed and we've been operating for some time together. So we have our I don't know how big we can be and still be effective. But I guess I would offer up that that we are hearing people's feedback all the time. So one of the things that we do in our Monday meetings is we always revisit all of the comments that came in and the reviews that you give on your webinar participation, and we share those, and those become the foundational to some of the things that we plan going forward and some of our topics that we discuss. So I guess I would say first and foremost, we do hear from you. We hear from you all the time. And so as far as bringing in new folks, I think, Jill, that's a topic for you to sort of consider and think about with some of the rest of the team. But I think that I would want to just emphasize that we get your feedback all the time. So everything you're dropping in the chat box today, I look at it, Jill looks at it, other team members look at it. We develop FAQs from it, and it guides future training and efforts that we undertake. So so continue to talk to us at least in that fashion.
Yeah, definitely. I would echo that. Yeah, questions and feedback along those lines, it's really helpful, and we do take that definitely to the group. Another couple questions around kind of the same theme about will guidelines be developed regarding the type of sanitation centers will need to perform, should centers start replacing carpeting, kind of facility kind of issues. And I would say, to answer that, we don't know. Those are some guidelines that again, we'll be partnering with our other departments, like Department of Public Health, to help to provide some guidelines around those various issues regarding facility and such. So more to come on that. We don't have the answers to those questions right now, but hope to. And when we do, we would obviously be providing them.
And I think, Jill, those might be things that would be appropriate when we revise that 7015 form. It might be the kinds of things that we put in that facilities section. So it's clear to everybody what the expectations are.
Yeah, definitely. Another question is, will there be a time frame given to centers for the transition? And yes, that is, what we're hoping to provide is some more clarity on kind of what we're looking for time frames, so people have a clear understanding of kind of expectations. So yes, we will be providing some time frames around that transition and period, and again, when we get to the point when we're back in full center-based services, we will have a again, that will be clear for everybody, just in terms of expectations around that. And let's see here. Just looking through some of these. Questions are coming a little faster now, so I'm sorting through these.
Any themes?
Themes, we're talking, some of the themes have to do around just requirements for participants getting back into the center. Will they need to have a new H&P, a TB negative reading prior to starting? Will they need to go through the referral process again, such as initial assessments? And can you expand on why this might make reopening more challenging?
Oh, I'll take a stab at that. So so I think that it's much to be determined on how this looks and the expectations that we'll set. But I think that it sort of goes without saying in some ways that you'll need to be doing some reassessing, some level of reassessing, whether it's at the initial level or not, but at some level of reassessing for individuals and their ability and willingness to return to center-based services. For many, this has been a long time, and some of them may have declined and may not be able to make it back or may not want to come back. So there's a lot of things that would need to be considered in reevaluating their status for return to in-center services. So assessment will definitely be part of this process. But how we define that and the requirements for that, I think is more to be developed. And then there were questions regarding TB. I think that all of you are familiar with the requirements for the program as they're written in regs and in our standards of participation in the waiver, et cetera. So TB for the time that we have been operating in TAS has been something that we've said for new participants, you could do that later, but do it prior to bringing people back into the center. So we said that back in an all center letter, I think back in May or June, whenever we put out new enrollment information in an all center letter. So I think that will be an expectation. Any questions that we still have to do with will there be other levels of testing that need to be done prior to returning to the center? Because one of our rules for participation is evidence that an individual is free of communicable disease. So, so at any rate, we have lots of questions about that. But yeah, I think that eventually all of those usual rules for bringing participants into the center will apply. It's just a matter of as we transition back, will we have a gradual ramping back up of the requirements? And again, much more to be determined there.
Here's a question regarding in-center services, currently under TAS, and then and with the vaccines, with participants now starting to receive vaccines. If a center has received approval for in-center services, under TAS, and they have participants who've already received 2 doses of the vaccination, essentially considered maybe fully vaccinated, can they start providing in-center services for those participants now?
So the in-center services rules that we issued in our all center letter, 2014. I don't know, Jill, check me on that one. We gave some guidelines, and that's when we developed the 7015 form. If somebody could check that for me, that'd be good if we could get that reference. So at that time, we talked about in-center services and what was appropriate. And prior to that, we actually talked about, well, in that all center letter, we basically said that that only providing in-center services if it were safe and if it were in concert with the rules that we issued. I think it was in ACL 2006, which specified that center services would be allowed if they were provided in a non-group modality, meaning you were not bringing people together in groups and congregating, keeping people in close proximity and doing modalities that were together. So we gave the example of in-center services that were sort of more individualized, bringing somebody in for assessments, bringing someone in to see the nurse. So we made the comparison to what it would be like to go into a physician's office, say, get your service and leave, as opposed to what we all know as, you know, the group setting for services that ADAC CVAS is, where people are in one room, they're getting services together, they're in close proximity. So that has been not allowed in this entire time, and that still holds. So we have not retracted any of that guidance. We anticipate that we are going to be making some modifications to that, but there are many things that we still need more guidelines from our public health colleagues on that before we have that going on. So there should not be significant numbers of people being served in the center and concurrently in group settings at this point.
Thanks.
Regardless of vaccination status.
Right. I think one other question that comes in is, Erica, you might have to clarify, but is the hybrid model mandatory? A lot of our staff and participants are refusing the vaccine, and this may be a liability for the center. So I don't know if you're referring to, if you want to clarify, Erica, that question in terms of, I don't think, we're not saying that the center is required to provide long-term provide telehealth and center-based services. If you have participants, and I think, you know, and we'll again, as we move to get more clarification from Department of Public Health in terms of what the requirements may be for this type, for the CVAS adult day healthcare facilities around vaccines and requirements for staff and participants attending, and we'll work to get more clarification on that. For the moment, it remains kind of until we do. That would be a good discussion for your center, just in terms of your policies and procedures, in terms of being able to, if you have proper safety measures in place, and that, and how you are able to care for participants potentially who may not be vaccinated, or what your policies are in terms of serving people who may not be vaccinated, or utilizing staff who may not be either.
And I think I'd like to just, I'm not sure I entirely understand the question about whether there would be a mandatory requirement for a hybrid. I mean, I think that what we're trying to express here is that as we think about what an orderly transition back in center looks like, we recognize that it can't happen all at once, and that we're still in this public health emergency, but we do have varying degrees of readiness in different communities and in different centers for returning to some level of in-center services. So there's not a mandatory, and we're not even really talking about a hybrid per se. We're just talking about how there would be a period of time where it would be expected that that as participants are gradually brought back in, assessed, planned for, programs ramping back up, that there would be a need for a continuing of providing services in the way that is safest, and so that we keep our participants still safe at home and connected. So again, a lot of details to be worked out there, but the issue of people, participants saying no to vaccines certainly is everybody's right. It's always a participant's right to decline any of the services that you have. Just having listened in on the community care licensing webinar yesterday, again, these questions are yet to be answered by our public health officials. They're working like crazy to get these things answered. But the community care licensing in residential facilities where people live, it is their right to decline the vaccination, and that they live there. That is their right. We don't know if there will be a different standard applied to ADHC, given that there are requirements. They don't live there. This is a community-based program. It's a day program, and people have the right to decline services. They could decline getting their TB checks and getting evidence from their physician that they were free of disease, and then you wouldn't be able to enroll them. So again, we don't know if there's a similar standard here that will apply with COVID, yet to be determined. So at any rate, just keep it in mind, but there's no mandating of some kind of a hybrid model at this point. It's just how we're thinking about a rational and orderly way to return to center services.
Thank you. So we just have a few minutes left, and I want to just pivot real quickly because we have several questions related to something we talked about earlier in the presentation related to the incident report and reporting for COVID. So as just a point of clarification, the requirements for reporting COVID positive cases, it applies to all the centers are required to report when a participant has tested positive, has an actual positive COVID test, and you would only report for those participants who you are currently serving inside the center or inside their home. So if you are not providing any services to participants in person, let's say via telehealth or even doorstep, you would not report those instances of those participants. You would only be reporting positive cases of participants who you are serving inside the center or inside their home at this point. Okay. Let me see here. Okay. Just scrolling through, so we have some other common themes here with questions. Okay. And some people are asking again, just in terms of timeline, knowing that there are many factors affecting the return to center-based services, is there an estimate when that might occur, timeline? And I say, we don't know, and I even hate to even guess at this point, because every time we guess, something changes, or we'd have to move that. So we can say, we are, as Denise, I think, indicated earlier, we want to move as quickly as the environment and the circumstances allow, and as long and as to the degree we can ensure safety for participants and for staff. So no estimate on timeline at this point. Okay. All right, so there may be some other questions that we didn't get to in the question box today, and I would say that we have these questions, and we'll if there is especially, and I know there are some that pertaining to actually change applications that Arlitra was speaking to earlier. I would encourage you to reach out to Arlitra or Eric, our certification team desk, with those specific questions that you have for your center. Adam, can you move to the next slide? Any questions, if you don't have specific email addresses for staff, you can email them to our CVAS mailbox, and we'll get them to the right person to answer this question for you. So we are at time today. I want to just, and I think we got to the bulk of our questions, but maybe some, and we'll try and respond to as we can to maybe some of those outstanding ones that we didn't get to via email or follow up with you individually. But I want to just, before we close, again, just thank you for all of you for being on the call today. Again, this is probably first of many webinars that we may be hosting and that, or that we're a part of in the upcoming several months. And I'd also like to say thank you, Denise, for her participation today and for walking us through this discussion regarding, kind of the vision and their plans for the upcoming months and year here. Again, thank you to all of you for all you do and the services that you provide. You do great work, and many participants and families I know benefit from the services that you provide to them every day. So I just want to say thank you to you, and again to all our partners too, DHCS Public Health and the managed care plans as well. With that, I'm going to wish all of you a nice evening. And again, if there's any follow-up questions, feel free to send them to our CVAS mailbox. But have a good evening, everybody.
Thanks. See everybody soon.
Thanks.